Hi, I'm Lijesh. Here I'm doing a PowerPoint presentation about norovirus.
The purpose of this presentation is to provide better knowledge about norovirus and to familiarize the norovirus guidelines. Norovirus often occur in closed communities such as long-term care facilities like nursing homes and care homes, overnight camps, hospitals, schools, prisons, dormitories and cruise ships. Norovirus is the most common cause of gastroenteritis in England and Wales. Norovirus spread more easily in winter, especially because of closed or semi-closed atmosphere, and tends to cause vomiting. So usually it have been called winter vomiting bug due to its shape, also known as small round structured virus. In 1968, an outbreak occurred among children at Norwalk Bronson Elementary School in USA. After this outbreak, it also called Norwalk-like virus. In 2002, International Committee on Taxonomy of Viruses approved the name norovirus. The first symptom caused by norovirus is sudden onset of nausea followed by projectile vomiting and watery diarrhea. May have raised temperature, headache, abdominal cramps and pain, aching limbs and loss of appetite. If symptoms are severe, dehydration can occur. The intubation period of norovirus is around 12 to 48 hours. The illness is self-limiting and the symptoms will last from approximately 12 to 60 hours. Most people make a full and uncomplicated recovery. The virus spreads by several routes, such as fecal oral, vomiting aerosol, and contaminated food or water. Shellfish and salad ingredients are the foods most often implicated in norovirus outbreaks. There is no specific treatment apart from letting the illness run its course. Encourage patients oral fluid intake to prevent dehydration. Intravenous fluid therapy may require in some patients. Dehydration can be life-threatening. Hand washing with soap and water is an effective method of preventing transmission of this virus. And bear in mind, alcohol hand gels are less effective as norovirus lacks a lipid viral envelope. According to QH Kingston guidelines, patients with diarrhea and vomiting or vomiting with unknown reason must be isolated and should be cared for in a single room. Obtain stool sample from symptomatic patient as soon as possible. Stool containing urine can still be tested for Clostridium difficile and norovirus. Isolate patients on symptoms without waiting for the result. Any member of staff who develops symptoms at work must go off duty immediately. Diarrhea and vomiting assessment and management tool form must be completed if a patient has diarrhea and vomiting. Definition of diarrhea is more than 2 episodes of type 5 to 7 stool in 24 hours. The IPAC team and divisional bleep holder must be notified. Disposable gloves and aprons should wear whenever contact with an affected individual. Masks not recommended. Hands must wash after removing of gloves and aprons. No discharge or transfer of patients from a closed area to another ward or department or another hospital or nursing home or residential home. Patients who are well enough may be discharged to their own homes. Patients' condition require transfer to another department or hospital The situation must discuss with receiving institution so they may prepare for isolation practice. Restrict visit to essential staff and essential social visitors only. Encourage patients to hand wash before eating and drinking and remind them to wash their hands after using the lavatory. Ensure hand hygiene when leaving affected area. Staff must not eat or drink in the affected area. Maintain stool chart for all affected patients. Must be accurately monitored for signs of dehydration and appropriate therapy should be given if needed. Use single patient use equipments wherever possible. All other equipment must be cleaned with chlorine releasing detergent and water. Linen from affected area must discard into a soluble seamed bag and then place inside an outer bag before sending to laundry. For surgery in theatre, only must-do cases to do, and it should be done last of the list if possible, or another spare theatre if available. Theatre administrator to be informed. All professionals must aware the risk. Minimize the number of persons inside the theatre. Remove stock trolleys and unnecessary equipment from theatre. One circulating practitioner should be available to deliver the needs from outside of theatre. All staff should wear gloves and apron. Wash hands as protocol after removing gloves. Recover patient in theatre to minimize the transferring of patient to another area. Theatre staff should assist recovery staff inside theatre. Change scrubs after the care of patient. Clean the equipment in theatre and trolleys with the chlorine releasing detergents. Domestic staff must clean theatre after the procedure. Domestic supervisor should be contacted. Here is a copy of diarrhea and vomiting assessment and management tool form. Thank you for listening.